Okay, we're gonna get started because that'll get everyone back in. Now the next panel, and I'm Mark Goldstein from UCSF Health Hub. One of the big things that we do at Health Hub is we basically work with early stage companies and we help them find great investors, mentors, or help them with getting clinical trials. So what we're doing right now is we're going to feature 3 amazing early stage companies. And these are 3 truly great companies, all focused in mental health. And this isn't so much of this isn't like a pitch contest that you'll typically see. We're not at Shark Tank. That's not what this is about. This is about basically the companies taking 5 minutes, talking about why their product is so great and why it's so important. Sure, if you're an investor, they'd love to talk with you too. But they're basically talking about why their product is really making a difference. So I think we're going first. I think, Rebecca, you get to go first because you're the one who got off the plane. Where are you? Up, come on up. So Rebecca runs Lucid Care, which is virtual reality for drug and alcohol abuse. And it's really, think of it as an alternative to a traditional program, like an AA or an opiate center. And really, she has a great solution, really, that puts patients in a really safe state of mind. And it's an alternative to a Riva or other, a script that someone might take, but it's very consistent from what we just heard on the last panel. So, Rebecca, take it away.
Okay. Thanks, Mark. I appreciate it. Hi, everyone. I'm Rebecca. As Mark said, co-founder and CEO of Lucid Care. When I was 15 years old, I was here at Children's Hospital of Philadelphia. This is where I was diagnosed with a brain tumor. When I awoke post-surgery, I was a completely different person. I discovered that I had a new personality, had mild cognitive impairment, and epilepsy. My neurosurgeon even told me that there may be a chance that I won't go to college. So, understandably, I developed anxiety, and I was given antidepressants to help me navigate through my new reality. But the symptoms were so bad that I had to stop altogether. And instead, I became committed to helping myself and accelerating my behavioral change through meditation and a lot of resolve. So a few years ago, I started working at Samsung, and that's where I discovered virtual reality. And when I discovered virtual reality, I understood that this was the missing link that I wish I had to help accelerate my own recovery. So once I understood that, I left Samsung and became a VR consultant at Stanford Children's Hospital. And there, I helped co-develop the first VR study to reduce anxiety for kids right before their heart procedures. And I took those learnings to start my startup, Lucid Care. My co-founder and myself decided to focus on the drug and alcohol epidemic because we understood that these patients also suffer from severe anxiety and are dealing with cognitive impairment themselves. 1 in 10 Americans suffer from a substance use disorder. So we knew that we could use VR to make a fundamental impact on their lives. According to NIDA, 90% of patients that are abusing alcohol will relapse. 60% of patients abusing drugs will relapse. This is a crisis that is on the rise. We know that it takes up to 2 years for patients abusing methamphetamines to regulate and to regain their full cognitive abilities. So how do we expect patients to advocate for themselves while in treatment? One more time. Okay. While in treatment. Okay. So, Lucid Care. We're transforming the way disorders are treated and managed. What we do is we help patients develop positive daily habits that keep them in treatment, and they use these skills to apply throughout the recovery. We've developed this digital therapeutics platform that uses virtual reality to reduce anxiety and cravings within minutes. So how does it work? A trained VR facilitator comes into the rehab centers and runs VR sessions up to 10 minutes at a time. The facilitator shows experiences that are highly immersive, focusing on emotional regulation and enabling patients to focus, often for the first time in years. We measure a patient's state of mind through self-report assessments and tracking technology. And we're building this proprietary database so that in time, we can more easily predict which patients are more at risk of dropping out and alert the clinicians so that they can provide them more personalized care. We currently sell directly to treatment centers and are already working with hundreds of patients. We are working with the largest drug Medi-Cal treatment centers in Los Angeles County, and we have 5 pilots. In these pilots, we've shown a 57% reduction in anxiety. Anxiety is one of the top reasons why patients drop out. We are making a difference. So I started Lucid Care because I wish I had VR to accelerate my behavioral change. So I built the right team to do this. My co-founder and CTO, Yahav, developed the first FDA-approved VR product for neurosurgeons. He also developed fighter jet simulations in VR for the Israeli Air Force. We're supported by an amazing team of advisors. Unfortunately, I guess there's some writing issues up on this. We're supported by amazing advisors from Stanford and opioid experts, as well as from the LA Department of Public Health. And we have an operations team based in LA. Next one, okay. We plan on expanding beyond treatment centers to medical-assisted treatment, and we'll be working with methadone clinics and also physician offices that are looking for a tool to increase patient adherence. Ultimately, we're pioneering the way that behavioral health disorders should be treated. They should be treated as a chronic disease, and chronic diseases require patient engagement. At Lucid Care, we believe that the patient is part of the solution, and we teach them how to manage their chronic disease and help them lead fulfilled lives. So if you have any questions about our mission or would like to talk more about what we do, I'd be happy to answer any other questions. Thank you.
That was a phenomenal story. Rebecca, congratulations for starting that company and what you're doing. I mean, this is exactly the type of thing that we want to see. What's that? My mic's not on. How's that? Okay. Rebecca, you're amazing. So next up is Chris. So Chris Lento is CEO of FreeSpira and also known as Palo Alto Health Sciences. He's been around for a while. He comes from 25 years in the biopharma space, so that's quite different. And but he also spent quite a few years at Pear Therapeutics, which is probably one of the pioneering digital therapeutic companies out there. We're going to see a digital solution for panic attacks, and it's really an alternative to a Xanax or a Valium. And Chris, I said I wish I heard about you before I got up on stage, but and take it away. Take one of those. Yeah, should be.
Oh, good evening, everybody. How are you? Mark told me I had 5 minutes today.
Is that one working? Let's see.
Working?
No.
How about this one?
Yeah, you're good.
Let's try again. Mark told me I had 5 minutes to do the presentation. I practiced it twice this weekend. The first time I did it in 3 minutes, it was way too fast. The second time took me almost 45 minutes. So we're going to try it for the third time here, and hopefully it's a charm. I'm Chris Lento. I'm actually the Chief Commercial Officer, not the Chief Executive Officer, but thank you. We are Palo Alto Health Sciences, ironically not located in Palo Alto, but Kirkland, Washington. Let's see here. There we go. Our product is FreeSpira. FreeSpira is an evidence-based, FDA-cleared We kind of call it a digital therapy because it includes both hardware and software, but it's cleared by the FDA as a Class 2 medical device. We're cleared to treat symptoms of panic, panic attacks, panic disorder, as well as PTSD, an indication we received this past summer. The product, in short, is cleared to treat patients 18 years or older. As you can see there is a tablet that connects via Bluetooth to a CO2 sensor. The key to this therapy and versus other breathing devices are that we actually measure CO2. The patients use this product at home twice a day, 2 17-minute sessions per day over a 4-week period. And they are actually getting biofeedback or feedback from the tablet, and they're shooting and targeting for target respiratory rates and target CO2 rates. Let's see, I think I'm going the wrong way. All right, let's go. There we go, we got it now. I'm going to skip forward because I realize I have a lot of slides. So the problem here is panic attacks, panic disorder. Depending on how you measure it, 19.1% of the US population has some form of anxiety disorder. We can put an estimate for panic and panic disorder is roughly 27 million people in the country suffer from this disorder, many of who are not being treated or not being treated adequately. So when providers, behavioral health specialists, primary care providers are looking to use our product, they're actually looking for patients both on the behavioral health side, mental health side, as well as the medical side. Disorders such as generalized anxiety disorder, phobias, and so forth have a high prevalence of panic attacks. They actually progress to an actual diagnosis of panic disorder, as well as medical conditions such as irritable bowel syndrome, cardiovascular disease, migraines, COPD. Those patients have a high prevalence of panic as well. So we go from 27 million up to 50 million if you want to include other patients with high prevalence of panic. They're typically treated with medication and counseling. Our product is not meant to displace medication or counseling, but as we heard earlier, medication is fraught with some problems. The medications are addictive, they're expensive, patients are not very compliant. On the counseling side, and I know we have some psychologists in the room, I appreciate and recognize all the great work you do, but counseling has its limits. It's very hard to deliver. Patients are not compliant with their face-to-face visits, and the system sometimes falls apart on the counseling side. We do, however, need these therapists, psychologists, psychiatrists to help us deliver this intervention. They're an integral part in delivering free spirit for patients. Just a little bit about panic, and if I ask people to raise their hands in the room, which I won't, I bet a good chunk of you do have experienced symptoms of panic or panic attacks. Patients think they're having a heart attack. They can't breathe. They feel something's wrong. And what they do in most cases is go to the doctor. Worse, they go to the ER, where they're treated for something other than panic, cleared, and their disorder is allowed to continue driving costs upward. With our particular product, and one of the inherent physiological effects of panic is patients suffer from chronic hyperventilation. This is caused by having too low of CO2 in the body. Time's up already? Wow, that was 5 minutes? Do you want me to just stop right there? Okay.
No, keep going.
Okay, so just 2 more points. We are evidence-based. We have run a series of clinical trials. The one on the left was actually done at Stanford, right down the road. The one on the right was our real-world trial done in multi-centers. The key here and where we're honed in on is fitting this product into physician workflow and having the patients engage with the therapy. On top of the phenomenal clinical response rates, and you can see there, 80, 90% of the patients are panic-free or getting a statistically significant response. The patients engage with a 91, 86% adherence rate. That means they're completing all 56 therapy sessions. 2 more slides. We have progressed to the point where Highmark's Vital program took us on a test drive. We graduated their program, and we do have full medical coverage as part of their medical policy for their 5.2 million members in West Virginia, Delaware, and the state of Pennsylvania. So we are fully commercial. Two more slides. Our care model actually has two points. A provider authorizes the product, screens and authorizes the product for the patient. We ship it to their provider. Provider trains the patient. Patient goes home and uses the product for 4 weeks, and they're assigned a free spirit coach who's doing regular check-ins with them on a weekly basis to increase adherence. And lastly, we do have a PTSD indication. We're in the process of scaling that. I spent today at the Palo Alto VA, where our product was tested, and from where we earned our clearance. And we'll be hearing more about that in the near future. Thank you for the opportunity this evening.
Great job. Thanks, Chris. That was another just perfect example coming off the last panel of the types of sort of augmenting therapies that we're starting to see in market now that are really getting adoption. Let's see, so who gets to go next? Oh, Mainul. Mandel, come on up. Ellipsis Health is a really very, very cool company. It's actually funded by KOSLA, and Alex did mention it in the past. And what basically, they want to make behavioral health a vital sign. And he's going to talk about sort of like a score, and he basically does it through speech capture. And it's incredibly innovative and exciting, and take it away.
Thank you, Mark. Can anyone hear me? All right. Thanks, Esther. How about this? All right. I hate my voice, but it's important. Well, thanks for being here. So, Mainul, Mondal, the founder and CEO of Ellipsis. So I'm going to go through a few questions here, and we'll pause to think about what we're doing and why we're doing what we're doing. What is voice? Right? Think about this. It's been around for a long, long time. Voice is the original measure of well-being, right? That's how we have communicated with people. That's how we communicate with human beings, right? When you go home after work, you call your loved ones. If your grandma or your elderly friends are out in some other state, you want to check in how they're doing, right? That's happening in the developing countries, developed countries. But if you think about also places like Nairobi, Kenya, right? Or a village in India, name it, right? What's happening there? You have frontline workers who are sitting with the mothers, with the patients, and they're chatting, they're connecting, right? Now, voice has a lot of rich information. It's not being used the way it could be used in healthcare. Okay. Now, pause there for a second. Think about what has been happening in the last few years, right, in chronic conditions. Thinking about how do you manage your type 2 diabetes, and so on and so forth, right? People have focused a whole lot on physical health, right? You have therapists, you have coaches, right? But if you really sort of dig deeper, right, the core problem is depression and anxiety, the state of mental being, right? And so for us, when we looked at it and said, okay, look, we want to build something that's going to be scalable, because there's nothing right now scalable to measure depression and anxiety. There's nothing. You have a paper-based form that you go through a list of 9 questions. You spend 10, 15 minutes doing that, right? So we said, all right, what do we do? So we looked at voice. I said, you know what? You open up so much when you talk to your providers, when you talk to your loved ones, right? So we need to find something that's measurable, that we can act on, and that can scale not just in the US or Silicon Valley, across the globe. The vital signs that we have now for physical health, we all have thermometers at home. We all have some sort of blood pressure cuff. There's nothing for behavioral health, right? So what we are creating here is the first behavioral health, clinically valid marker for depression and anxiety that you can use. And now, the question is, how are we doing that? Right? So it could be any conversation, right? We do take permission before we use it. Right? Any conversation, whether it's a device agnostic, obviously. We take that conversation, and our machine learning algorithms look for semantic and acoustics, right? What you say and how you say it. Because you could say, I'm doing well, right? And I would fool you. It's how you say it. So we combine a bunch of things here. We need a few minutes of conversation, and the user knows when that conversation is being recorded. It's being streamed live, and it sort of gives out a vital sign. So it measures your depression and anxiety score in real time, right? Now, if you were to sort of take this, going back to sort of thinking about whether sort of use case around, and we'll get a little deeper in the use case soon, but thinking about, having a parent-child conversation, or maternal health, suffering from depression and anxiety, right? So our goal is to sort of use it across many, many use cases. I will focus on 2 that we'll be talking about today, and happy to answer more as at 8:30. So our first deployment, or first large-scale commercial deployment, is going to be with Aetna and Apple. Aetna and Apple have been working secretively the last few years. They finally launched an app called Attain, right? Now, we're not in charge of the design, obviously. It's Apple, right? What we're in charge of is actually providing the voice engine, right? So if you're an Aetna user, and if you're going to use this in fall or later this year, you're going to have an Ellipsis engine there, right? It's a human-machine dialogue. They'll say, how are you doing? How's the week been, right? And in real time, you'll get a score for the vital sign for depression and anxiety. Now, Apple has been, obviously, as always, very, very innovative. They're providing a lot of incentives to use the app, right? So if you use the app, you accrue points, you get to buy an Apple Watch, and whatever, right? If you go to their website and you'll find the release, you'll find a lot more information of how they're planning on engaging users. So our goal is to work with about 1 million users for the next 2 years. And if that is successful, scale across all of Aetna. The second one we'll talk about, this question came up, I think, during one of the sessions, being used for primary care providers. I mean, if you look at PCPs, the frontline workers, the nurses, the case managers, they don't understand behavioral health. They don't understand depression and anxiety. What we're doing is we're augmenting, right? We believe in the human relationships. We believe that you need to have providers. So what we are going to do is actually augment that. This is going to be a buddy, your advisor for behavioral health, right? So the way Intermountain is going to be using this is that during a primary care visit, as you're connecting with your provider, we get that speech, and then we let the PCP know what the level of depression and anxiety is, because based on that, there's standard care pathways. So what we end up doing is that we do the warm handoff so that Intermountain providers can take actions. So where I started was that it is the original measure of well-being, and where we are going with this is that voice is going to be the future of our behavioral health. Thank you.
That was great. So we saw 3 great companies. And again, we're not voting for them. They're all winners. And so congratulations, guys. You're all total winners.